The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now, here along with Dr. Bonati, your host, Kimberly Brummel.
Hello, and thank you for joining us for American Medicine Today. I'm Kimberly Brummel, along with world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute. Thank you for being here, Dr. Bonati.
Thank you, Kimberly.
Today we'll inform you of the incredible success Dr. Bonati and the Bonati Spine Institute have achieved for over 30 years and over 45,000 procedures for patients that were living with back and neck pain. We'll hear from Wounded Warrior, Master Sergeant Michael MacDonald, and the story of his remarkable recovery, and have an open panel discussion on the state of the medical crisis that's happening in our country today, better known as Obamacare. We'll be joined by board-certified neurosurgeon Dr. John Grossmith and our American Medicine Today radio co-host, Jeff Wagstaff from News Radio 970 WFLA. Dr. Bonati advanced medicine to a new level, allowing many pain sufferers to achieve results on treatments pioneered while advancing the field of knee, shoulder, wrist, ankle, and other joint ailments using arthroscopy. Dr. Bonati is credited with patenting and perfecting the field of minimally invasive laser spine surgery called the Bonati spine procedures. Dr. Bonati, what made you move away from conventional open back and neck surgical procedures, and when did you develop these patented techniques?
Well, I was initially an open back surgeon, but the results, they were very poor. It is reported, there are different numbers that they report the failures or the successes of the open back procedures. For example, in fusions procedures, there are some reports of 60% failure. If you do more than one level, you do 2 or 3 levels, they go to 80 to 90% failure. So you need to imagine a young individual with a bad result. All his life is gone. He remains in medications that they go from simple painkillers to narcotics. Then the depression sets on their mind, and then they need to have antidepressive medications. They cannot sleep, then they need to have sleep medications. They are also unable to work, so they need to be practically in disability. All this brings to these individuals a situation of psychological effect, and they end in psychiatric care. So imagine somebody on 30 or 40 years old in those conditions, their life is gone. Usually they lose their job, they lose their families, and they end in a very precarious economical situation. So with that experience, I start to feel that that was not the way to treat, and I tried to avoid treating spine problems. Despite that I was trained in neurosurgical procedures and in orthopedic procedures to help spine problems on the patients. So I just hated it, and I thought there was a different way to do it, and that's when I start to think what type of a different approach will benefit the patients, and we developed the technique around probably 25 years ago. And from that time on, we start to apply this technique, we start to create new instrumentation, we start to create new approaches to this technique till we develop a perfect technique that allows us to recover patients of all the sorts of different type of a back problems that they incapacitate these patients, including failing back procedures.
Now, you have over 30 years of expertise and experience that you won't find at any other spinal institute in the country. The Bonati spine procedures represent a very high patient-reported success rate of over 94%. And in fact, recent research reflects that the patient satisfaction level is truly at 98.75%. No one else can claim or duplicate that type of success. What do you attribute to that particular success rate?
I think we are very careful in the way that we participate on these surgeries. Not only we educate the patient to let the patient understand that the surgical procedure is a team approach. It's not something that the patient is going to go to sleep and forget it and then wake up in the recovery room. A lot of patients become very petrified of just the idea that they are going to go to surgery and they would need to be awake. But if you take the time to talk to them and explain them that this is not going to happen, they are not going to be in pain, they are going to be able to feel some movements and some touching and things like that. If the patient can control that, then they enjoy the procedure because they can see what is happening on their body. But the beauty for the surgeons are that every time that we approach areas that they are practically where the patient is complaining of the pain or the problems, we make the patient a partner. And we ask them, is this better? Is this, the pain is gone? Is this hurting yet? And then the patient moves and try to put himself in positions that they create the pain or created the pain before. So in that way, we can develop and return to the patient the most effective way to return them to health, because sometimes the problem is not in one level. But if you go and identify each level and educate the patient what is going to happen in each level, then the patient also identified that certain area that is the cause of some of the pain will be targeted in the first procedure. And when that happens, they always go and they say, okay, that area is clean, that area doesn't hurt anymore. But I still have pain on my big toe. Well, that is a different nerve. So they understand that. So they participate with that. Education in this procedure is very important. Participation of the patient during the anesthesia is also very important.
When we come back from a short break, we will speak with a former patient who received treatment at the Bonati Spine Institute, and he'll tell you firsthand how the patented Bonati spine procedures helped him.
Revolutionary in his field, Dr. Benady created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to American Medicine Today, presented by the Bonati Spine Institute.
Welcome back to American Medicine Today. I'm joined by Dr. Alfred Bonati, credited with patenting and perfecting the field of minimally invasive laser spine surgery called the Bonati spine procedures. The Bonati Spine Institute's board-certified neurosurgeon, Dr. John Grossmith. We'd like to tell you the story of wounded warrior Michael MacDonald and his remarkable recovery.
So problems with my back began probably 10 years ago when I was a much younger man, and they just gradually got worse. About 5 years ago, I really started searching for an answer, and I never really found the answer that I liked. I was really going downhill fast. I could feel it. I could feel that my mobility was nowhere near where it was, and that I really needed to do something. So it was really serendipitous that I met him when I did, because that was about the time that I really decided I needed to do something. And then once he had his hands on me, it was really quick, it was fast. He got me in to see him, and the day of the surgery, he had me in, I guess surgery started about 10, and I was done a little after noon maybe, and I was up and walking around the hotel that night. After meeting Dr. Bonati and him performing the surgery, I was able to not only continue upon the path in the military, because honestly I thought I was going to have to go ahead and cut that short, but I was not, and I've been able to continue to serve in the military, serve my country. I'm very proud of that, and I thank Dr. Bonati for that. It also has allowed me this opportunity to open this gym, this training compound facility that we have.
When we treat him, we were very surprised how fast he recovered. Not only because his physical conditions, because his will to recover. And today, this man is training people, is having fun, is jumping from a plane. He's doing all these crazy things that he was accustomed to do and enjoy very much, and looks like a kid.
I can't thank him enough. If it wasn't for him, none of this would be possible.
Like every patient that we treat them and we get them back on life, we're blessed.
Dr. Bonati, what was the extent of Michael's injuries and how were you able to help him?
Well, Michael is a master surgeon. He's a tremendous amount of physical abilities create sometime in the past some injuries to his spine. When he came to us, we evaluated him and we found that we were suitable patient for us to help him and recover him. We did a couple of procedures on him, and it was amazing to see how well he did, and he's back to his tremendous amount of demanding exercises this time.
Dr. Grossmith, is this a typical result? Can any patient expect to return to almost any activity, sport, or hobby?
I would say the short answer would be yes, but I would have to expand on that to say that not everybody is necessarily an athlete. I would say that we treat a spectrum of patients in each decade of life, so that if you're not an athlete does not mean that we cannot do something to help you. I would also say that there's a lot of degradation of your lifestyle if you're living on pain medications, which I think is the result of still having your problem, not having a localization or finding after visiting multiple physicians, surgeons to have intervention or treatment. So I think that's a major accomplishment if you arrive debilitated, such as a cane, walker, in some cases a wheelchair because you're in excruciating pain. You're on narcotics, in which the narcotics are at the point in some cases you're at narcotic intolerance, meaning you need more and more pain meds for less and less relief. And to take such a patient or patients and relieve that by finding and localizing the sources of the pain, I think is a very rewarding and in some cases eye-watering experience. And so for them to have relief, for them to, for instance, in the operating room say it's gone, and in some cases like just last week the pain had been there say 4 years and everything looked okay in the fusion, but in that particular case the fusion, a portion of it had grown down over the nerves that were causing the pain. On the imaging studies, it didn't look that much of a problem, but as most physicians know, if you listen to your patient and if you have a knowledge of sources of pain, you can do a pretty good job at localizing the problem. And so what was, say, disregarded as a situation where the patient could have benefited by surgical intervention, it was described as your fusion looks good, there's nothing else we can do, you can live with the pain. That individual was in tears because of the relief, and also reported the ability to walk to the car after the procedure from the recovery room. And so I think we've seen that over the years multiple times, and I think it energizes us to continue what we're doing.
Thank you, Dr. Bonati and Dr. Grossmith. Thank you for joining us today, and we hope you'll stay tuned as we return with an open panel discussion on Obamacare, or the so-called Affordable Health Care Act. We'll be joined by our American Medicine Today radio co-host, Jeff Wagstaff from News Radio 970 WFLA.
All my pain is gone, gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Welcome back to our final segment of American Medicine Today, featuring Alfred Bonati, MD.
Welcome back to our final segment of American Medicine Today with Dr. Alfred Bonati. Now we're joined by Bonati Spine Institute board-certified neurosurgeon Dr. John Grossmith and our American Medicine Today radio show co-host Jeff Wagstaff from News Radio 970 WFLA. So Dr. Bonati, now you've had all this phenomenal success and many of these success stories, but what do you see as the main problem in medicine today?
I believe that the problems that we're going to face in medicine today are really in the very near future. And the system is going to cave in to be able to perform and serve the patients with the freedom that we were able to do it till now. It's going to be restrictions created by new laws and an intrusion that is very unintelligent created by politicians. Look at the disaster that these political ill-prepared individuals create in the country today. They put in shambles one of the best medical health care of the world. They never did a study of what will be the consequences. And today we have in the country 20 million people that they are losing their insurance. And that is before really is going to be an attempt to change also the insurance on the people who is today secure with insurance by corporations. When that starts to happen, I understand that around from the 100 best corporations in the country, around 70 they are going to not offer anymore health care to their employees. When that starts to happen, the disaster is going to be enormous. Doctors are not going to be able to supply the need for health care with the service of governmental pays. So it's going to be a restriction for the patients to find the doctors that they are going to be able to serve. So they're going to be always doctors that they are poorly trained or doctors that they don't have a good income, that they are going to serve the government. But the quality physicians are not. So the restriction is not going to be only to the quality of medicine. It's going to be a double tier of service. Good service by individuals they can afford, and horrible service by nationalized type of a product. So not only is going to affect the service, but also is going to affect the hospitals. Hospitals are already opting out on some services. So what's going to happen, there are going to be lines of people trying to be treated. And these things that they are talking about, that is not going to be panels that they are going to decide for the people what type of a treatment you are going to have and at what age you are going to be cut off from service. That happens in other parts of the world. And we're copying that. What is amazing is the lack of responsibility of the politicians.
What problems do you see that are needed to correct the problems with Obamacare?
Obamacare needs to be thrown away. Obamacare is a disaster. It's going to affect, if you really look, the population in general is going to need to pay a tremendous amount of increase in premiums. The individuals that they are in a seniority status right now, the seniors, are going to see a double charges because they are going to start to disappear certain type of services that they are accustomed to receive now from Medicare. Medicare is at this stage, Medicare is 38 trillion with T deficit to be able to perform. And they're taking 570 billion from that pot there. And to create another governmental type of a service, I don't understand that. We already know that Medicare doesn't work well. Medicaid is a disaster, and now we're going to create another disaster. Where is the responsibility?
Well, how can we help our viewers protect their rights, and what do you feel they need to do?
I think the viewers, they need to really participate. The individuals in the country are very, very healthy, very accommodated. They are they are the richest people in the world. Even if we talk about the poor here, it's not a comparison with the poor in any other country. So that situation needs to be stopped by the citizens. The citizens, they need to once for all participate and vote right.
Jeff, how do you feel about what's happening with Obamacare, or the so-called Affordable Health Care Act?
Kimberly, I can really only tell you how it's affected my family. I've always had a family plan. This year, I'm very proud that my daughter's graduated college and is now in the workforce, but we have 3 separate individual plans to maximize the benefits. And this is coming from the changes that we've seen from this legislation. I have a policy, my wife has a policy, and now my daughter has a policy, and that's how we had to ensure our family to have the very best coverage. So my concern is that it's hurting American families, not helping us be insured.
Now, Dr. Grossmith, how do you feel Obamacare is going to affect you as a surgeon at the Bonati Spine Institute?
I think that it's time that the physicians should verbalize and demonstrate they clearly understand what this issue is about. Many of us have been clear on it for years, and it's falling on deaf ears. There's not enough pressure and unity in presenting that, you know, there are going to be people who are injured, killed in treatment, in medicine. And when you're delayed for your chemotherapy, you're delayed for your imaging study because you have a brain tumor, when you are not a candidate for surgery, when in the past, when the surgeon and the patient, and those are the 2 individuals who should be involved in these decisions, life was preserved, progress was made in medicine, but now we're into Mother May I, you're going to practice in this manner, and we're putting in the cockpit the people we want up there.
Now, Dr. Benady, what advice or last thought would you like to leave our viewers with?
That we need to have 2 reactions. The first reaction needs to be by physicians. We need to block the service totally to an abnormal, useless healthcare. And to do that is refuse to receive any patient that participate on this type of programs. First, because we're not going to be able to serve these patients right. Second, if we try to serve these patients with all our heart, will be interrupted by tremendous amount of paperwork and governmental intrusion. You will not be able to last too long before you're going to get the government taking your records and trying to modify the way that you're going to practice. This is going to affect every physician, the good ones and the bad ones. So physicians need to stand up and say, we are now going to serve this system. Second thing that need to be happen is the person who is going to be treated is going to be, today, I probably be treated. Tomorrow, you probably be treated. So no one of us is going to escape one or other day of going to visit an individual who is going to make the decision in your life. And you want that that person will be properly trained, properly secure in his livelihood, so who can serve you properly. If the physician is going to be thinking how many dollars I'm going to have from Obamacare and is going to try to mend their income, so is going to be able to survive in his own family, his own psychological behavior towards the patient is going to change totally. So the way that I see that we can change this is that the citizen, the individual who the day after tomorrow is going to be on the bed of the hospital and is going to be thinking that the guy who is going to come over to serve him is an honest, responsible, well-trained physician, and that is not going to happen. So the individuals, they need to go and do a type of a referendum and say, politicians and this law needs to be removed.
I agree. On behalf of the Bonati Spine Institute and Dr. Alfred Bonati, I'd like to thank you for tuning in to American Medicine Today. We hope you'll tune in for our next edition, and if you're watching today and want to actively participate in life, this is your time. If you or someone you know is suffering from head, neck, back, or leg pain, stop living life on the sidelines. Call the Bonati Spine Institute at 855-267-0482, or you can visit the website at bonati.com.
Revolutionary in his field, Dr. Benady created, perfected, and patented the Bonati spine procedures. Using his genius, Benady invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA, Saturdays at noon.
The preceding program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.